In this video, we will first show you our Plasma Care device, how to put it into operation, and how to attach and remove the spacers properly. The Plasma Care set consists of several components. The hard case, which should always be used for transportation and possible maintenance of the device. The docking station with power supply unit. A training spacer is included in the Plasma Care set. In this video, however, we will show you how to use a disposable single-use spacer. Please plug in the power adapter after connecting it to the docking station. In order to charge the Plasma Care device, put it in the docking station, which is also an ideal place to store the device. Note: the Plasma Care device is very sensitive to shocks and should not be dropped or exposed to severe vibrations. The device itself consists of the basic unit with touch button and the plasma source. The charge indicator light is located at the top right. When the device is fully charged, the charge indicator light flashes green. During charging, it flashes alternately red, green and yellow. The device only works when a sterile spacer is attached. Now let's move on to the first steps on how to operate the device. Remove the foil from the sterile spacer blister pack. For the time being, leave the spacer in the open blister pack, put it aside and proceed with the following steps. Switch on the device. To do this, place your thumb on the Plasma Care touch button and wait until the plasma ring indicator light flashes white. As soon as the white light starts flashing, please remove your thumb from the touch button. Please note that a slight tap on the button is sufficient to switch on the device. There is no need to apply pressure. Pick up again the open blister pack and push the head of the device onto the spacer located in the pack. The spacer's removal tab must be on the top side. Now push the Plasma Care head into the cavity of the spacer until a click sound confirms that the spacer has locked onto the device. You will now hear a beep sound and the plasma ring indicator light will flash blue while the device is initializing. This usually takes 15 seconds but can take up to 45 seconds. Once the initialization is complete, the plasma ring indicator light will turn continuously blue and the beep sound will stop. Now the wound treatment can start. You should place the spacer-equipped head of the device directly on the wound, so that ideally a closed plasma volume is created between the skin and the spacer. Start the treatment by gently tapping the touch button of the device with your thumb for approximately 1 second. Continue to hold the device in position. It will stop automatically after 60 seconds. Each of the 4 segments of the blue plasma ring represents a 50-second treatment interval. For more details on wound treatment, see our video on how to treat wounds with Plasma Care. After 60 seconds, a therapy cycle is completed and the device stops. For larger wounds, you can perform up to 6 of these cycles on different wound sections within a time window of 10 minutes. For this purpose, the Plasma Care is positioned on the next wound area and the treatment starts again when tapping slightly the touch button. One spacer allows you to perform a total of 6 treatments over a 10-minute period. Is this time limit or the total number of 6 treatments per spacer exceeded, the plasma ring indicator light flashes red and the spacer becomes invalid. It is very important that you do not switch off the device in case of multiple use of one and the same spacer. In other words, please remember to tap the touch button just for a short moment to restart the next treatment cycle of same spacer. If the touch button is pressed for more than 3 seconds, the device turns off and the corresponding spacer is no longer usable. Especially in case of larger wound areas, we recommend to carefully plan the wound treatment in advance. How do I divide the wound in different sections? Where do I start the treatment and where should the treatment end? To remove the spacer, hold the device with one hand and push the spacer tab away from the device with the thumb of the other hand. Please do not pull the spacer from the device using force. If you have any further questions, please do not hesitate to contact us. You may contact us via email at info@terraplasma-medical.com.